Okay, so here is the Lab 5 video. We're going to be doing the bones of the appendicular skeleton, and I'll give you an overview of each bone as we go through. Okay, so this is the clavicle, and the lay person's term for the clavicle is collarbone. Don't want to hear anyone using the word collarbone though. Okay, so the clavicle has a medial or sternal end, and it also has a lateral or acromial end. Okay, and since this bone is kind of horizontally placed in the body, it's a really good one to use for discriminating medial and lateral as terms. Okay, now the clavicle, I'm actually holding this kind of the opposite orientation to what it would be in the body. You can verify on your own body that on the sternal end, the medial end, that end is anterior, and then the bone kind of turns posteriorly and then angles over to the acromion on this lateral end. Okay, and we can tell that this is the superior surface because it's smooth. If you look at the inferior surface, this is the surface that is grooved. Okay, and it's grooved because of the big subclavian artery that is running past there that causes the bone to remodel in this area. Okay, so this would be the clavicle. Okay, now we're going to switch to the other bone of the pectoral girdle, and this is this beautiful flat bone, the scapula. Okay, so the scapula has, because of its shape, it has several corners. All of the corners are called angles, and it has several edges, and the edges are called borders. Okay, so first we have to figure out medial and lateral. So we know that this is where the upper limb is going to attach. Okay, so this is going to have to be on the lateral aspect. So coming from this surface, which is the glenoid cavity, we have our first corner, and that is the lateral angle. And as we go past the lateral angle, we have the lateral border. Okay, then we come to the inferior tip of the bone, the inferior angle. And then we come up the opposite side here, and this is the medial border. Okay, so the medial border extends all the way up to this corner. This is the superior angle. And then we have this edge here, which is the superior border. Okay, just to recap again, glenoid cavity, lateral angle, lateral border, inferior angle, medial border, superior angle, superior border. Okay, now in the superior border, you'll notice there's an indentation. This is another location of remodeling where nerves are going past here and blood vessels. Okay, and this is the suprascapular notch. Okay, past the suprascapular notch, we have this kind of blunt shaped process. This is the coracoid process. We'll hear more about this when we get to the muscles, because this is a location where your pectoralis minor muscle has its origin. And then we have the larger flat process, which is the acromion or acromion process you'll see in some books. Okay, now connecting the acromion to the rest of the scapula, you have this ridge of bone, which is appropriately referred to as the spine. And then we have several depressions on the surface of the bone. Okay, so this depression, since it's superior to the spine, is the supraspinous fossa. Okay, this one, since it's inferior to the spine, is the infraspinous fossa. And then as we turn the bone over, we have this large, broad shallow depression, and this is the subscapular fossa. Okay, so that takes up all of our landmarks on the bone. Now, we mentioned that this glenoid cavity had to be lateral, and the spine is always posterior. So that would mean that this particular scapula would have to be a right scapula.